And welcome back. May is Mental Health Awareness Month, and it takes a village to care for those with the disease, including members of our local faith communities.
And joining us to talk about a first-of-its-kind event for faith leaders and some resources for anyone in the community, we welcome Rebecca Fairman, Executive Director of Connections for Mental Wellness, and Deacon John Bundra of Nativity of Our Lord Parish. Good morning to both of you. Thank you for being here.
Good morning. Thanks for having us.
Rebecca, let's start. You guys did that in unison. Good job.
We've been practicing.
Tell us a little bit more about Connections for Mental Wellness.
Absolutely. Connections for Mental Wellness is a community collaborative known as a collective impact model. We bring together just a diverse group of stakeholders from government to faith leaders, community advocates, school systems, all of the health systems in Green Bay are involved as well. And our main goal is really just to provide education, reduce stigma, and provide better access for mental health care services.
Rebecca, tell us about the event for faith leaders and why you decided to have it.
Well, when we think about the statistics, 1 in 5 individuals suffer with a mental health issue. And so oftentimes faith leaders are the first contact for help with mental health issues, and so we really want to provide that education, information about resources, and the best way to look at referring and addressing the issues.
Deacon John, let's talk about your personal experience in assisting those with mental illness.
Well, so I've been ordained just 5 years now, and my first day at Nativity, the first call I got, someone called into the parish, and it was transferred to me, and the administrator said, "I have somebody on the phone, high anxiety, sounds very depressed in a dark place, and is talking about taking their life.
Wow.
Do you want to take the call?" And so at that point, I said a quick prayer and took a deep breath and said, "Sure." And so I talked to that person. I said, I know you're a person of faith, which is why you called here. I said, "Can we take a minute and pray?" We did. I'm happy to say that after about a 30-minute conversation, things really worked out, very well. And I knew that I had to really start to understand more about what mental illness was about. The first 3 months of my time at Nativity, I had at least a dozen, either walk-in, phone call, people who were in similar situations. And I just thought, okay, I have to be able to do more than just talk to them. I have to start to recognize maybe some of the symptoms, etc. When I finished the first call that I talked about with the woman in the dark place, the administrator said, "How did the call go?" I said, "Great." And she said, "I'm glad you were here, because normally we just give them the phone number to the crisis center, and we hope for the best, and we never hear about it after that."
Now, the Creating Hope event, that is targeting faith leaders, correct?
Correct.
Okay, and that is happening on May 30th. So if you or someone in your family is part of that faith community and want to receive some more education, it's happening at the Green Bay Botanical Garden, connectionsmw.org. But if you need resources for mental health available locally, this is for everyone. It is myconnectionsnew.org. Thank you both for the work you're doing.
Thank you.
You're welcome. Thank you.